Hi everybody, Dr. Darrow here. This is a special recording to all those who don't understand tinnitus or tinnitus, especially those in hearing healthcare that are confused also. So allow me to elaborate. Tinnitus is most often, about 90% of the time, the result of neural degradation in the auditory system. The so-called phantom sound that haunts nearly 50 million people in our country, which is not coincidentally the same number of people who suffer with hearing loss. It has been shown to result from significant changes to the auditory system. Now, tinnitus, which results from a breakdown of the sensory and neural connections within the inner ear, can have its origins in noise exposure, medication, genetics, or simply just getting older. Regardless of how you get tinnitus, it's most often, again, 90% of the time, a sign that there is a major underlying condition, hearing loss. I challenge you to find a human or an animal model in which tinnitus exists within the auditory system, right? So not from dental or other system issues, where it's present in a truly normal auditory system. You can't. See, patients don't understand this fact, but I have to assume most in hearing healthcare do. Quote-unquote normal hearing, as defined by audiologists, has been found in subjects with over 50% of neural connections missing from ear to brain. As somebody who has studied the brain anatomy, performed countless experiments and brain dissections, as well as being a certified dementia prevention educator, I am acutely aware of the fact that dementia is more accurately defined as a fatal brain failure. Dementia is a terminal disease, much like many forms of cancer that physically kills patients. Perhaps the comment that dementia does not have a 100% mortality rate is because some patients die of complications of dementia or some other natural cause before the dementia actually kills them. But I also assume people suffering with dementia or caring for a loved one with dementia find little comfort in this fact. See, Dr. Bredesen, he said it best. Everyone knows a cancer survivor. No one knows an Alzheimer's survivor. It's a real powerful statement. In hearing healthcare, it is our obligation to hold the welfare of each patient paramount, which means we must present each patient with the facts and the strong medical recommendation to treat their medical disorder. And we must teach them what each symptom means. So for example, if a patient has tinnitus, they must understand why. If a patient complains of difficulty hearing and background noise, they must be told why. When a patient has hearing loss or the underlying symptoms of hearing loss, which is a progressive degenerative disorder, they must be recommended to treat their disorder to thwart the unintended consequences that are correlated with hearing loss. I'm talking about increased risk of falls, cognitive decline, hospitalizations, institutionalizations, dementia, and even premature death. As always, take care and stay safe and keep striving towards excellence in audiology.